Hi, my name is Joe Lindahl. I'm the CEO for the MSA Coalition, and I'm pleased to be able to provide you some updates of what we've done as an organization and where we are headed in the near future. First and foremost, I'd like to thank our current board of directors. They're fiduciaries and stewards of the organization, and their responsibility really is to look up and out, to prioritize and strategize, oversight of resource allocation, generation, and to be future focused on the needs of our community now and to prepare ourselves for what's needed in the future. I also want to quickly introduce the MSA Coalition staff team. These individuals are responsible for the day-to-day operations of the organization, and they are committed to the mission and vision of the MSA Coalition. So last year, we went through a strategic planning exercise to reaffirm our core purpose, look at our revised mission statement, and create the first ever vision statement for the organization. It is to improve quality of life for the multiple system atrophy community by expanding access to care and support while advancing research towards treatment and a cure. These three pillars that you see listed, advocacy and awareness, education, support, and research, have always been constants for the MSA Coalition. But we've reinforced these three, and then it helps us prioritize what are the initiatives, what are the things that we need to focus on to make sure that we're being impactful and consistently evolving for the ever-changing needs of our organization, our patients, our care partners, our researchers, and everyone that's engaged with our community. The first one I'd like to touch on is the advocacy and awareness. Our aim is to be the megaphone for MSA. Our strategy includes several different initiatives that address both public policy and enhancing understanding and awareness to multiple audiences. For advocacy, we created the new Advocacy Committee, which generated our first ever advocacy agenda. We joined the Unified Parkinson's Advisory Council, also known as UPAC, last year, and we launched our new Advocacy Action Center, which you can find on our website. We've continued to support the National Plan to End Parkinson's Act as it advances through the House and the Senate. And we're excited about future projects, which will highlight what makes MSA unique and how our needs are also specific as it pertains to future legislation. We're going to need the entire MSA community voice and perspective. So keep an eye out for an opportunity to advance our cause in the next few months. The Coalition is an organizational member of the National Health Council, Global Genes, the National Organization for Rare Diseases, the National Institute for Neurological Disorders and Stroke, also known as NINDS, and we continue to support MSA awareness with our healthcare communities at the Movement Disorder Society, the American Autonomic Society, and many others. Education and support. Hopefully you all have had the opportunity to engage with MSA Connect, our new online community, which is an online platform specifically for the multiple system atrophy community. It's a place to share ideas, resources, perspectives in a safe and private environment. We established our new Centers of Excellence program this year and hope to announce the inaugural list of centers in the coming weeks. We know how difficult it can be to navigate the diagnosis and needed care for MSA. So we are working diligently to identify centers that will provide you with knowledge, skills, and multidisciplinary care in one place. Access is incredibly important, and to that end, we have translated some of our most popular resources and handouts for our global audience. How to participate in clinical trials, what is MSA, and our MSA Coalition brochure have all been translated into both Spanish and French. We will continue to make ourselves more accessible and inclusive in everything that we do. Research. As you can see from these numbers, we provided a significant amount of resources to support MSA research. This support comes via our seed grants and our collaborative core program. This past year, we created a brand new strategic oversight body charged with leading our research agenda and our priorities. The new Research Steering Council is comprised of leading experts in the field with a mixture of clinicians, basic scientists, and translational practitioners from around the world. With this new group, we are going to consistently evaluate our research funding strategy to ensure the best allocation of valuable resources possible to maximize our impact. In addition, we believe more researchers investigating MSA, the better. And thus we support early investigators, early careers in the field by providing scholarships to attend and learn more about MSA through the European Autonomic Society Scholarship, the Don Summer Memorial Travel Award Scholarship for AAS, and other ways. We've also enhanced our staff support specifically in research. Jesse Urigi, our new research and medical education manager, has recently been brought on to help support new research initiatives, provide additional research and clinical trial information to our patient and care partner community, manage our Centers of Excellence program, and further our organizational engagement with like-minded medical societies. We work diligently and collaboratively with our pharmaceutical industry partners to ensure the patient voice is heard loudly and consistently through their drug development process. We thank them for their support and shared belief that therapeutic pursuits should be wholly patient-centric. So I've been talking a lot in past tense, and I'm very much looking forward to talking future tense. We have a lot to talk about. We are going to be releasing a brand new website in early 2024. We know how vital and important our website is, and we've been listening, testing, and working to enhance every aspect of the site to make it more intuitive and useful as possible. Thank you again to those of you who support this work by completing our website survey earlier this year. We've taken to heart your insight and can't wait for you all to experience a cutting-edge online experience. Also next year, one of our priorities is to enhance our patient and care partner resources, including our phone line, our peer support groups, and adding more resources to our inventory. We'll be adding dedicated staff to grow this work because we understand how important direct, real-time, or near real-time interactions can be when providing guidance and support. There are several advocacy and awareness initiatives that will be needing volunteer support. As we continue to work towards better understanding for MSA beyond the science, real-life testimonials of how MSA impacts a person, a family, a community, resonates loudly and brightly. We hope to provide tools and opportunities for you to share your lived experience with MSA so we can continue to advocate, enhance awareness, and bring MSA into a larger public consciousness. We are going to continue to add more patient resources, both online and in print. One of the priorities is to ensure we're adequately addressing the MSA journey with sufficient education and resources for the entire patient pathway, as well as considering the various channels, online, print, on demand, sequential learning, and more, because we know everyone has a different learning style and lifestyle needs. In concert, we're going to be pushing out more webinars throughout the course of the year. Again, thanks to your feedback, we're going to be spreading out knowledge to be both timely and less congested in the smaller time periods. And this is just the beginning. There's much, much more in store next year. So before I go, I want to say thank you. I want to say thank you to our incredible donors and fundraisers in the community. Without your support, none of what I just mentioned would be possible. Your generosity, your passion, your commitment has positively impacted numerous lives in our community. So I want to say thank you again, and I hope you enjoy this year's conference.